Well, gaps in COVID-19 vaccination rates among different racial groups have been well documented by many groups, from the Centers for Disease Control and Prevention to our own local government.
But a new study from the CDC and New York City and state health departments finding another disparity, this time among New Yorkers living with HIV.
And News 12's Noelle Lilly spoke to LGBTQ healthcare workers who are on the front lines.
As New York City continues its fight in the COVID-19 pandemic, health officials say folks living with an HIV diagnosis are less likely to be vaccinated. It's something Alex Perez sees every day as a nurse practitioner at Callan Lord Health Center in the South Bronx.
People might have a lot of stigma, a lot of fear to come to get health services because of past experiences.
A quarter of patients at Callan Lord are HIV positive, and a third don't have insurance.
People making fun of them when they say that they are a trans person. People purposely calling them by the old name or the death name. Also, people just denying services because of their gender identity.
Data released today by the CDC with New York City and state health departments found that vaccination rates are even lower when a person with HIV is Black, Native American, or Latino. And like other marginalized groups, Perez says misinformation about the vaccine is a big problem.
Some people living with HIV, they might think that will affect their status, their immune system, or they think they might interact with the medications or with their hormones.
But he says that so far the COVID-19 vaccine has shown to be safe and it won't interfere with HIV medicine like PrEP.
We recommend it because some people living with HIV are immunocompromised, so the more protected they are, the better.
Perez adds that building trust is the best way to increase vaccinations among those living with HIV.
And it's something that has happened with my patients when we talk. Because if they don't feel trusted, if they don't feel comfortable with the provider, more likely they're going to avoid coming.
Callan Lord clinics can be found in Manhattan, Brooklyn, and the South Bronx. In Melrose, Noelle Lilly, News 12.